that names are important, but have you noticed this phenomenon in hospitals that the doctors talk in diagnoses, they refer to patients by their diagnosis? I've had entire lists handed over to me or described to me where the name of none of the patients was actually given, but it was the gallbladder and it was the pin and plate and it was the knot and, 60-year-old. And the danger comes when we don't share a common language for discussing it. And the most courteous, the most humane and the most natural thing to do is to use the patient's name. So when I don't know the name of a patient, I say the patient having the whatever procedure, and then I try to make a point of finding out what it is. And when somebody says to me, we've got a gallbladder, I'll say, what's their name? And they'll say, I don't know. I say, well, find out who they are and then we'll talk again. And they say, no, I've got something else to do. I said, well, do you know who they are? No. Well, then can you find out who they are and then we'll talk again. And it takes a lot of insistence sometimes to do that because people operate in that way. Nurses, I have encountered sometimes, talk in bed numbers. And so imagine when a person talking in diagnoses talks to a person talking in bed numbers and they don't actually connect, but they assume. And of course, when you assume, you make, thank you, all those Odd Couple fans.